Hello and welcome to North West Tonight. Nearly 2,000 people living in care homes in the North West have died as a result of coronavirus. The figures compiled by the Office for National Statistics reveal that just over 1 in 4 care home deaths were as a result of COVID-19. Here's our chief reporter, Dave Guest.
Marie Griffiths, mother, grandmother, great-grandmother.
She was vibrant, she knew her own mind, but she was full of fun. She was a secretary. She'd worked for Vimto years ago. She worked for the Tax Inland Revenue, unfortunately.
But at the age of 97, she became one of so many care home residents to succumb to COVID-19. Marie was one of 10 to die in the space of a week at her Lancashire care home. For her family, their grief is made all the worse by the fact they couldn't be with her in her final weeks.
The sad thing when she was in hospital, as with everybody else, you can't get to see them. We did manage to do some Zoom calls, but it's not ideal, is it?
A heartbreaking story, but sadly one that's become all too common in these harrowing times. And now, for the first time, we're able to tell you how many people, like Marie, have lost their lives to coronavirus in this region in care homes. The Office for National Statistics has published figures for each local authority area between early March and the 1st of May. There were just over 750 deaths in care homes in Greater Manchester, Salford and Stockport seeing more than 100 each. On Merseyside, 471 deaths, 140 of those accounted for in Liverpool alone. In Cheshire, 329 deaths. In Lancashire, 230, 30 of those in Chorley. And in South Cumbria, just over 60 deaths, 18 of those in Barrow. So, what's the situation now?
For us, at the present moment in time, we hopefully believe we've turned the tide. We haven't had any deaths or any incidents in the last 2 to 3 weeks. So, fingers crossed, God willing, we've turned the tide. Now, the hard part is now getting back to where we were before.
So perhaps a glimmer of hope on the horizon. But for so many families, the terrible events of the past few weeks are going to live with them forever. Dave Guest, BBC North West Tonight.
Now, as we've been seeing all week, hospitals have had to revolutionise the way they work to deal with the challenges thrown up by the pandemic. And what they've learned could have profound effects for the future as well. In the last of her exclusive series on the Royal Blackburn Hospital, here's our health correspondent, Jill Dummigan.
It's VE Day and the radiographers have decided to cheer up the corridor.
We just made these this morning, so just out of paper plates and actual cake holders.
The current situation's forcing everyone to make the best of what they've already got.
So are they...
On the general ward, they're trialling drugs already used for other conditions to see how they can help COVID patients. It's part of a huge national research trial known as Recovery.
They are looking to get interim results in the next few weeks, and that would be really encouraging, because if they can identify one or more of those drugs to be a benefit to the patients, then there is a chance that they can roll that drug out more widely.
On all wards, the advent of Zoom has helped patients and their families stay connected.
We've been Zooming nearly every day, do it on all our patients, and the outcome of it all has been really, really positive.
The hospital's using similar technology to fulfil many outpatient appointments, something else they'll be looking to develop in the future.
In these 6 weeks, with use of technologies, we have very successfully conducted patient interviews, patient assessment. This crisis has proven the opportunity of how we can work differently.
Back on the general COVID ward, one of the patients is waiting for a medication pack. Tony came here 6 days earlier after a month spent fighting the virus. Were you worried when you were in here?
How can you not be worried? You just don't know the way this thing's going to go.
But today, Tony's going home.
People do walk out of here. I'm a 64-year-old type 1 diabetic. Yeah, I've been in here and I'm walking out.
The first phase of this crisis appears to be easing. Now it's a case of getting ready for the long haul.
I think the new normal is going to be a new normal. We're not entirely sure what that new normal looks like yet, but we're planning for it and we're going to be ready for it. We'll just get on with it and get used to it and make it work.
Jill Dummigan, BBC North West Tonight, Blackburn.
There have been a further 31 coronavirus-related deaths reported in North West hospitals today. We also have around 2,000 people currently being treated for COVID-19. That's currently the highest number in the UK. Well, earlier on, the medical director of NHS North West told us he fears the region will have to live with the infection for a long time yet.
I think we have a long way to go still, unfortunately. So we've got a 100-metre race. I think, to be honest with you, we're maybe about 20 metres in now. We may find that as you described, there may be a second surge that will come through once we relax things down. We've got winter, we've got flu to come. And although we've now got this new antibody test, which means we can hopefully ask more questions, until we have a vaccine, which is probably a year away, we're in a position where the fact we have to learn to live with COVID and this new normal.